Okay, welcome everyone. I'm Nicole Peterson. We've got probably about a 20-minute presentation, and then we want to have time for questions and answers, and then some time to actually discuss next steps for the food system in general. So we're hoping that'll be helpful. I'm going to introduce two of our panelists who are here. First is Ray Gordon. He's a master's student at UNC Charlotte and has been working on especially the survey portion of this and the conversation focus groups. And then Mariam Jaliwala was really instrumental for just all the different phases of this. She's been working on it for a while. So they both were students, undergraduates at UNC Charlotte, and have graduated and are continuing to graduate school and medical school, which is just very exciting. So we're so glad to have them be part of this team. So as I think most of you know, and we're recording this for those who aren't here in person, we've been working on this project, the State of the Plate project, for 5 years. So we started in 2019 with the expectation that we were going to be starting our research in 2020. We had planning meetings with a lot of people, and you can kind of see we had a planning phase. We started with about 80 people that we'd kind of gotten to know over time, and that had invited in, that we'd learned about, and then we ended up with almost 100 people by the end of 2024 by now, over 100 people and organizations involved. And so in that planning phase, we really thought about what do we need to make this an effective assessment of the food system. So we wanted to get questions and concerns, issues, ideas from as many people as we could. And we identified 4 phases. We ended up with 3, but we started with 4 phases. And just worked on bringing as many people in as we could. We wanted this to be inclusive. So many of you are involved in designing some of the questions or the stages of this process. So we're really excited to be able to share our results with you. So we decided in the planning phase to do 3 phases. And our first phase was thinking about the assets and barriers around the food system for our organizations and businesses in Charlotte. Now, as you may remember, 2019 was right before the pandemic started. And so as we started this phase, the pandemic was happening. And so we incorporated a lot of questions around how people are responding to the pandemic and the food system. And it was really interesting. And Colleen's published a couple of articles on this, which has been really great. But we really are also interested still in how we can improve the food system for organizations and businesses. So those serving people in the county, through those multiple means to try to help provide food, to provide resources, to really support that. So we ended up with some interviews, surveys, and discussions that allowed us to really understand what was happening at that time from 2020 to 2021. Our second phase, we skipped our interviews because of the pandemic, so we decided to do surveys instead, and we did surveys. In 2022, we had household food security questions we ended up with around 700 participants in our survey. And we had recruited them from places like at that point it was called Loaves and Fishes, and some of the other organizations who we've been working with, because we wanted to make sure that we could really understand the experiences of people, especially those really struggling to get enough food. And so we had some gift cards that we were able to share, and we were able to ask these questions. And so we're presenting on some of that today. All of these phases have reports that are available on our website now. So we'll be happy to share that once we get to that point. And our third and final phase was community visioning. So we wanted to talk to people about our results. We shared what we learned from the surveys and from phase 1, interviews and surveys with organizations and businesses. And we wanted people to let us know how they were thinking about eating well, what kinds of things that help them to eat well, and then what we could do in the future. What kind of next steps did we want to do around the food system? And this was really helpful because we got really deep into some of the issues that we'll be talking about today. So we had 6 total listening sessions with 25 participants, and the American Heart Association was a fantastic partner on this. They provided some really great funding. But we also had sessions across the city to try to capture some of the different aspects that might be affecting people. So what we're going to do today is we are going to be talking about all 3 of these phases at once to really give you a sense of what we've learned across all 3. So again, these spanned from 2020 to 2023. So because of the pandemic, things went a little more slowly, but we wanted to share a sense of what we've learned from from all of this work. And hopefully that will guide us to, as a group, to talk about what our next steps might be. First, as I said, we asked people what it meant to eat well. And the top answer for everyone, especially in our survey, was eating fresh fruits and vegetables. So almost 70% of people said that was the most important aspect for them. And they were able to pick multiple ones. But 67% of people really emphasized this. And they also talked about home cooking. Almost half of people said home cooking is what it means to eat well. We also know that food quality and portions are important. And food quality was actually one of the highest concerns about assistance programs. So if you're going to be going to a pantry or going to a place that provides free food, they really want food quality to be as high as possible. They also talked about avoiding fried and junk foods, fried and junk foods. So again, trying to stay really with fresh vegetables and lean meats as much as possible. So almost half of people are avoiding those. And then the last category that we really saw when people were telling us about what it meant to eat well is food that gives energy. So there's a couple of pieces of this. So what it means to eat well. Some of it is about portion size and calories. So making sure that you've got the right portion size for what you'd like to do and how you'd like to eat, as well as the calories that you needed, either enough calories to satisfy hunger or concerns about making sure you're eating just what you need to maintain what you'd like to do. And then 20% of people were also specific about food giving them energy as an important part of eating well. So overall, we're seeing that a lot of people are really thinking about these fresh fruits and vegetables, high quality, fresh food, nutritious food, with a real big focus on improving their health. So just as a note, that was really a key issue there. We also talked to people about individual barriers, and we know that that cost is a huge aspect of eating well. And so the barrier that people mostly talked about were financial constraints, and 60% of people said that cheaper fruits and vegetables were at the top of their list for eating more nutritiously. We also know that, as we mentioned energy before, time and energy are a big consideration for people. There's a lot going on in people's lives, and being able to grocery shop and prep meals can be a struggle. And so convenience foods become a way to deal with that. So 20% in our survey said that having more time would help them eat more nutritiously. We've got money and time, which are we all know are very important for all of us too. We also have seen over and over again that transportation is a huge issue. We've been having this conversation for many years now. And so we've seen that people told us in their conversations and in the survey that limited transportation options really affect their ability to get to grocery stores or markets. And we know it was the second biggest concern for accessing assistance programs after that quality food that I mentioned earlier. So, as we're thinking about the food system, we're also thinking about our transportation system. And especially for some people, we know that mobility is even more difficult and more of a challenge. And so those with disabilities or older adults, we know that tasks like grocery shopping and cooking can be a real challenge, just to do those kinds of activities that a lot of us take for granted. As we mentioned, we were surveying of those 700 people, most of them were considered, by the USDA measure, food insecure. And 62.3% of those respondents self-identified as having a chronic illness, a physical disability, or a psychological disorder, all of which can make it challenging to feed themselves, to kind of get the energy to prep and purchase food. So we know there's a lot of concerns around how we're thinking about getting food. And this slide here really highlights those individual barriers, the ones that are specific to a household or specific to a person, and how they're eating or able to access food. But we also know that some of these, especially thinking about transportation, are tied to structural issues in our community. And so we've got a few slides, and I'm going to welcome Ray here to present on his work that he's been working on around systemic barriers to food security. So Ray?
Thank you so much, Dr. Peterson. So throughout the phases of this study, actually, we were able to hear from so many people in Charlotte who are experiencing food insecurity, and they were able to tell us their stories in a myriad of ways. And in doing so, we were able to highlight several systemic barriers that continued to, arise out of their stories. And Many of these we already know a lot about, such as uneven quality in prices, geographic disparities, and high cost of living. But residents, food insecure individuals in Mecklenburg County also shared with us the frustration that they're feeling about what they perceive to be a lack of priority in addressing the root causes behind some of these systemic barriers. So, with uneven quality and prices, going to the next slide, we can kind of see how this is highlighted a little bit with two-thirds of food insecure, almost two-thirds of food insecure residents within our survey population, as Dr. Peterson shared, stating that cheaper fruits and vegetables would make it easier to eat nutritionally. This came back up again when we talked to individuals in our community discussions, where a participant here at the bottom expressed their frustration about they shouldn't have to worry about scraping up money to eat healthy, and how expensive it is to try to bridge that gap with healthy foods. And um, again, mimicking that in our survey data, prices was the most important quality for individuals who are food insecure, followed closely by quality of food. Keeping in mind that individuals could choose more than one option from the selection so that we could get a more nuanced picture of what was going on, of the experience itself. That's why these numbers don't necessarily equal 100, but both of these were the most important factors for food insecure individuals in our survey population. Up top, you can see a quote of one of our participants sharing um, that the quality in the grocery store where she grew up in a low-income neighborhood, the produce smelled so horrible that the quality was really reflected there for her, and still was in her memory to this day. Coupling with that is geographic disparities. Often seen tied hand in hand, we have public transportation here, an individual, again, expressing and lamenting public transportation not really being adequate for them to be able to get where they need to with grocery stores. Another participant talking about low-income neighborhoods and how there are little tiendas and stores everywhere, but they don't necessarily carry the healthy foods that would otherwise be in other neighborhoods and other locations. Following price and quality, distance to home was actually the third most important factor when selecting where to purchase foods for food insecure participants. Still over half of the food insecure population of our study actually still said that distance was a big deal for them. And distance to home was the second most important factor for food insecure participants when choosing assistance programs, with over 16% of food insecure individuals from that same survey sharing that they can't access food assistance programs because of distance. Both of these are coupled with the next one that I want to talk about, which is the high cost of living in Mecklenburg County, where people, because of geographic disparities and because of uneven quality and prices, people have to pick and choose where they're going to put their resources. People are expressing frustration about housing not being affordable. Again, almost two-thirds of our population within our survey who are food insecure shared that money is a primary barrier for accessing safe and nutritious foods. Um, for reference, the average household income in Mecklenburg County for residents is a little over $69,000 annually. Two-thirds of our food insecure participants made an annual income under $50,000 a year. And the average income for our food insecure participants of the study was a little over 29,000. So that's less than half of the annual average income of the county. Now, all of this combines and couples to create this perfect storm for residents where they're experiencing a lot of frustration about a lack of getting to the root causes and a lack of priority to addressing the root causes. Participants identified a lot of these for us, but because they feel like they're not being addressed, they feel like a bit more like a percentage or a statistic rather than a person with a lived experience in a complex system. And a lot of these issues, again, we know a lot about and are very much reflected in those systemic barriers such as high housing costs, lack of job opportunities and grocery stores in areas for residents that carry quality produce, but also a lack of consideration and awareness and understanding for lived experiences and disabilities, as well as the overall cost of living and the cost of healthy food. Down below here, this quote, I just want to highlight for a second. An individual is expressing that they make over the annual income poverty threshold. However, they still are struggling to be able to make all the ends meet, pay all their bills, and take care of their family. This is causing a lot of stress and frustration for participants that actually was demonstrated by the language they used. Getting into this next slide, I want to kind of highlight a couple of quotes for individuals here who shared with us their experience. And in their own words, people are interpreting this as a struggle for survival, a struggle to make ends meet for them, a struggle to find and access healthy food is a struggle for survival, which is culminating in worsening physical and mental health outcomes across the county.
In this next slide, I'm going to talk about the challenges to access the programs. In this study, we found at least 20% of those eligible are not using the programs and opportunities available. And this is due to the mismatch in the design of the program, a mismatch with the resource at home. But in addition to that, people found challenging online forms, online or long phone wait times, technology issues, or for sometimes for elderly participants, it was harder for them to even read the technology online. In addition to that, there was another barrier, which was their own personal kitchen spaces, as well as the program assumptions around these spaces, which leads to wasting food and not being able to access the fresh food that they had actually available. And that's tied to a cultural mismatch programs as well for the kinds of food that were donated. The programs do not match the kind of food or cultural expectation that the people had, or just overall confusion on the eligibility and dietary restrictions, such as low sodium diet or certain food participants that couldn't eat because of the health conditions they had. Adding to those complications, as well as the language differences, people have identified throughout some of the surveys and through our conversations, as you can see on the quote on the bottom where it says, they don't go to the farmer's market because of either because they don't know they can or they're just not comfortable with using it there. So we see another perspective for the barrier around that way. This next slide, it talks more about the on and off sustainable programs that aren't really getting to the root cause of the issue in the food systems. Participants mentioned things like poverty, marginalization, racism, systemic disinvestment that we had talked about just briefly here. So the big challenges here is the Band-Aid solution. It doesn't have a comprehensive or sustainable solution according to our participants, which can create distrust. So people, residents don't want to get involved, that they're worried about the new programs because they've had in the past programs, so they've been, in their words, harmful to them. So the solution is to think more broadly around community engagement and how to plan these programs with community members so that they're being served by, with the voice, how they're being served, what those are going to look like. So you see this quote on the bottom where it says about the unlearning the old norms that aren't working anymore. How do we process the opportunities we're listening, engaging, and just starting with the community? So we know that's a big concern for those who we talk about. And of course, lastly, the funding models are also a challenge for the programs. I know all of you guys here are working for these community organizations, know this, but as you see the quote here, we're looking at funding again. You get funding all day long for programs, but not operational budgets for people to lead, to maintain and really fund the community health workers or student interns that come in and actually execute these programs. So they say you got to fight a tooth and a nail for that. And that's a big structural barrier for organization. So I think overall, the solution is to rethink the funding models to include in these operational funds so that's possible for the organizations.
I want to start real quick with a big thank you to Miriam and Ray, the two student researchers who have been phenomenal on this project with us. And so we've heard so far about individual barriers that participants in this study have encountered, systemic barriers, and then things that are getting in the way of them accessing resources that exist. But we also know, and we heard throughout this research about the obstacles that the programs providing those services encounter every day. And so we want to speak it for a minute to both that there are a tremendous amount of resources and assets that exist within our community, but barriers to having them meet the needs of residents that arose before. And so our research identified these both in areas of infrastructure, that we have some physical spaces, and technology and other types of resources that and capacity that provides important resources, but it's not enough. And so there's a need for more physical infrastructure, more things like meeting space, refrigeration and storage, to be able to facilitate better meeting the needs of residents. We have a tremendous amount of knowledge within our food system sector about how our food system works, about agricultural knowledge, about nutrition and culinary knowledge, but a need expressed by many people to raise greater awareness about the assets that exist in our food system, but also the work that goes into making it operate the way that it does. And that there's a need for better sharing information and resources across our food system with key stakeholder groups. And then finally, some operational barriers around being able to have enough staff at organizations, and having sustainable funding, so that the resources needed for that staff, even the resources needed to go out and find that funding, are things that it can be really challenging to access. On the whole, we heard throughout a desire for more collaboration, for thinking about our food system holistically, meaning that that's collaboration between both the food system and housing and transportation and the healthcare system and the myriad of needs that people have. But then also a collaboration throughout the region between producers and distributors, and finding ways that we are all working together towards the same goal. And so this leads us into the last couple of slides, and recommendations that came out through all 3 phases of our research over the last many years. And what we heard is a need to engage more with communities, to hear from them, to incorporate their perspectives and their expertise into the programming that's available, both to build trust and in order to improve the programming and opportunities for collaboration. In response to geographic disparity, there was a clear desire for more grocery stores that are located more equitably throughout our city, and all of which are offering high quality foods. But that brick and mortar solution can be a lot harder. So there was a request or recommendations for more delivery, or transportation options to get people or the goods moving throughout the city to overcome some of those barriers. We heard a need to reach out to those who are even further marginalized in our food system through health issues, or because they're facing additional challenges, single parents, or large families, or even veterans, or those facing other health challenges. There are recommendations for increased education as it relates to both sort of healthy eating and nutrition, but also understanding how our agriculture system works, and thinking about what the true cost is to producing the food that arrives on our tables or in our grocery stores. There were recommendations for addressing the stigma that may be associated with accessing certain programs, through things like mutual aid, but also how we can think about making resources available to everyone, so that people don't experience stigma because anybody could be accessing that. And then finally, thinking about anchor institutions, things like universities and the healthcare systems that can improve access to healthy and affordable food throughout our community. And then finally, we have some recommendations that arose that are thinking about sort of more general systemic challenges, right? And one that we've heard throughout and was mentioned again today, and that's that transportation is a key barrier for people. And so there are some concrete things that we can be doing around increasing the bag limits on public transportation, increasing awareness about what programs are in place to help people get where they need to go, and then thinking about, investments in our transportation infrastructure that could better facilitate the movement to food resources across our community. At the same time, we all know food is expensive. And so, how can we help people meet their food needs? Perhaps lowering costs where that's available, but also recognizing at the same time that farmers don't get paid enough for the work they do to produce our food. And so how do we balance both of those priorities? Thinking about better paying jobs, expanding eligibility for assistance programs, and otherwise providing resources to support people struggling with the high cost of living. And then finally, some broader recommendations around supporting and encouraging Medicaid expansion, and access to other opportunities that are already there and could perhaps be expanded. And then investing in adult education, and programs to help get people into those jobs that pay a living wage, provide healthcare, right, and provide a better safety net than some of the opportunities that are available now. So that is a very quick run through a lot of information that we've gathered over the last 4 or 5 years. I think if we go to the next slide, there is links and QR codes for reading the full reports from each of the 3 phases. So if you want a much deeper dive into any of the things that we've talked about, you can find them through these links. And Nicole has just put a link to the slides in the webinar, which also will get you the ability to click on these links so that they will work. And I think now we want to open it up to questions or comments. I'm not sure how that works in the webinar format, so I might let Nicole explain, and then we can talk about next steps as well.
Yeah, thanks, Colleen. And apologies, Colleen wasn't able to join us right when we started due to a personal issue, but Colleen Hammelman is an associate professor in geography at UNC Charlotte. So I was hoping you'd introduce yourself when you came in, but she's also been my co-PI on this project for the last 5 years. So it's been really great to work with her and the students. So we just kind of want to brainstorm with you all to talk about what we can do around these recommendations. So you can see on the right all of those recommendations that Colleen went through. And we'd love for you to think about how we can achieve some of these. Are there strategies that we can use to get to these, kind of solve these issues right now? However, we know we didn't include every recommendation possible. We really trimmed down what we presented today just to make it a little a little easier for all of you. So if there's a recommendation that you think should be in here that's not, we would love to hear about that as well. And then if neither of those really appeals to you, we really can think about how to build on a strength that we have in the current food system. So we were fortunate to have some people who were already involved in activities around food hubs or other things. And so we had a really good discussion last on Tuesday about what it means to really enhance the ability to get food from farms to restaurants and other places. So I'm encouraging you all to do that. We'd love to get your feedback. Join us by doing this here. What are the next steps for the project? This is really thinking about what we want to do, and the previous slide had this food system action plan at the bottom. So ideally, we'd love to be able to sit down and figure out given what we found, given what we know these are not new issues for the community. A lot of you probably sat here and thought, well, we knew most of this, right? It does give us a chance to really reflect on what hasn't changed over time and maybe why things haven't changed. So our recommendations are geared towards addressing some of the more root or structural issues in our food system that we think prevent real long-term or even in some cases short-term success. So to put together an action plan. And so this is our first step in sharing this information, in asking for your feedback and ideas. We're really hoping to develop with you an action plan If you're interested in working with us over time, maybe not today so much, but over the next weeks or months, again, just send me an email and we can, we'll have some Zoom meetings and see where we are with our recommendations and with just how we're thinking about improving the food system for our communities. So yeah, thanks for that question.
And I'll also add real quick, I know we heard over the years that past state of the play research was useful to various organizations as they went out and sought support for their programming to be able to point to some data, some research that confirms many of the things that we all know because we work in this space. And so that's why we made sure the full reports are available to everybody on these websites, and we hope that they will be useful to everyone in that regard going forward. But we're also always open to answer questions about what you find in those reports, or if there's bits of data that would be useful that maybe we didn't put into the reports because there's only so much in there. And so you can always feel free to reach out to Nicole or me, and we're happy to talk through more of that and find ways to make it as useful as possible.
So we really appreciate your joining us today. And as I suggested, if you'd like to reach out, most of you, I know most of you, so please, feel free to reach out to myself, to Colleen, and we'd love to continue discussing kind of what we can do to improve our food system. So thank you to all of you who've supported us throughout the years, and we hope this has been helpful.